Good evening, everyone, and welcome to our time check.
Good evening, Do.
Good evening po. Okay, start na po tayo. Baka may mag-submit ng mga dila. No? Walang nag-submit today. No? Siguro nag-enjoy talaga ng gusto ng weekend. Okay. Now, today, we are going to talk about cracked tongue. So, tingnan natin yung wait lang po. Tayo lumabas. Okay, yan. Cracked tongue, part 1. Okay, so karamihan ng mga medyo marami ng mga pinagdaanan may mga crack po. Pag normal yung tongue natin, we will not see any cracks, no? Okay, the tongue body should be soft and supple. Ibig sabihin, may mga fluids pa siya and nourishment through blood and yin. Okay, does that make sense? Okay, sandali lang po. Okay, so that means the reason why our tongue should be supple and soft is because hindi ka patuyo, no? That means you are still moistened by fluids and there's still nourishment through blood and yin. And what accounts for the cracks? Of course, para siyang El Nino, no? There is heat and dryness. So if you see small horizontal cracks, these are a sign of yin deficiency. That means you are already lacking fluids, okay? And hindi ka na that moist. So especially if the tongue is red, okay? As a rule, injury to substance does not occur unless the pathology has been there for quite some time. So, if you will not do anything to correct the deficiency or to correct the imbalance, yung crack na yon will already cause injury. By injury, we mean you will dry up, mauubos na yung yin mo. Of course, mayroon ng heat, so matutuyo na, okay, more heat until eventually it will become fire, okay? And this is one reason why cracks are rarely seen in the tongues of children, okay? Because it would take some time for the cracks to occur. So in adults, they appear suddenly. For example, kung nagkaroon ka ng matinding sakit or probably you had COVID that was very severe, okay, definitely you'll have a crack. And you just underwent chemotherapy, okay, and you are fond of smoking or you are fond of eating spicy food, okay? So, okay naman, basta wag naman araw-arawin. Tutuyo talaga. So, pag meron kang cracks, tapos yung tongue body mo is pale, this could be blood deficiency. Okay? Kung superficial lang siya, that means it is only stomach and spleen qi deficiency with blood deficiency. Okay? So, if the cracks are deep, of course, there will be blood deficiency. Meron na rin siyang injury sa fluids. Okay? So, easy na po. In a red tongue, if you see cracks, definitely meron na po siyang dehydration. Okay, red tongue, tapos may mga cracks. There is already exhaustion of fluids. Or meron ka ng stomach and kidney yin deficiency. Okay? Kanina, kung hindi pa masyadong malalim yung cracks, lalo na pag hindi pa masyadong nag-change yung kulay ng tongue, that would be stomach and spleen qi deficiency with blood deficiency. Pero pag nag-red na po yung tongue, so that means there's too much heat already. And so that means meron na po tayong stomach and kidney yin deficiency. that is due to injury from excessive heat in the nutritive and blood levels. Okay? So a red shiny tongue with cracks. So if you have cracks and your tongue is shiny, that is not a very good sign. That means there is severe yin and fluid damage. Okay? A single small crack on the tongue body is less significant than cracks distributed over the entire body of the tongue. So in modern China, we classify cracks into 3 degrees of severity: first degree, second, and third degree. So first degree is flat and short, okay? More or less, ano po siya, 0.55 mm, okay? So it's very, masyado lang siyang short, no? And you can see only 3 cracks. But second degree, identical to the first degree, except that we have more cracks, 4 or more. Ang third degree, mas malalim yung crack at depth of at least 1 millimeter and are longer than 1.5 cm. Okay. Now let's go to examples. Well, let's talk about this patient, male, 25 years old, 22 years old. Kulit naman ito eh. Okay. Okay. Anyone would like to comment here? So remember yung topic natin is tongue cracks, no? So definitely you can see cracks. Ano po yung grade ng crack niya? Do you see more than 3 cracks? Grade 1, grade 2, or grade 3? First degree, second degree, third degree?
Third na, Doc, third degree.
Sure. Malalim ba yung cracks?
Ay, hindi pa.
Parang second degree.
Second.
Second degree. Ang shallow ng crack.
So reddish daw yung tongue, malaki, slightly thin, and the cracks are horizontal. Okay, may deep vertical crack. Grade 3 na, kay deep man daw. Pero wala man ako makitang, okay, dito po.
Deep vertical.
Third degree po. No? Do you think this is more than 1.5 cm long? I don't think so.
Ano po? Balik daw.
cm, 1.5 cm.
Third degree na siguro to, no? Okay, whatever. So
Parang
yung symptoms, tinan niyo yung symptoms niya ha. Bakit kaya siya may chronic nasal congestion? Lungs yan, di ba? So nandito. What about pain and pressure sa nasal sinuses? Dito rin.
So, may cracks sa lungs, lung area.
Tightness in the chest and asthmatic attacks. So definitely pag sa anterior third, hindi ko talaga makita ha. Okay, so it's like a vertical crack dito. And then tendency to catch colds. Okay, let's look at the Western diagnosis. Meron po siyang allergic rhinitis, allergic asthma. So may family history siya, poor diet during puberty, emotional problems due to divorce of parents. Okay. Kaya yung mga may emotional problems, yung madaling na-depress, take a look at your anterior third. Baka may crack po kayo dyan, pakatuloy na yung tongue. Okay? So PCM diagnosis, onset of kidney yin deficiency. Which one? Here, horizontal crack, di ba? Onset of stomach yin deficiency and lung yin deficiency. So lahat na po. No? Okay. Let's go to the next, 49-year-old female. Anyone? So this time, ang tongue daw niya pale, pero may nakikita tayong crack. So ibig sabihin, pag may crack tayong nakikita, it doesn't mean na always siya red. No? Pwede maputla din yung tongue, pero may crack. Okay. Red siya in the anterior third. Pale ang tongue ha, pero yung anterior third niya, red.
Red.
Think of lungs and heart. Vertical crack here with horizontal cracks branching out. Okay, dry center, reddish center, thorns distributed. Okay, itong mga tinik-tinik. Yan, over the entire body. Symptoms, exhaustion. So, exhaustion, ibig sabihin, ito na po, tuyo na itong yin niya dito, yung essence. No? Thirst, dahil may redness na po dito sa anterior third. Severe palpitations. Can you see this? Red na po siya talaga. Headaches at the vertex, sa tuktok ng ulo. So, could be the liver or the stomach. Yeah, stomach. But the vertex, no? Stomach po yan. Nasa tuktok, night sweats. Take a look. Western diagnosis niya, iron deficiency anemia. Okay? So background to disease, caffeine and nicotine abuse. Caffeine is diuretic. Nicotine is bad for the lungs, no? So TCM diagnosis, who explain po this one? Ma'am Teresita, do you want to explain why my bucket blood deficiency?
May blood deficiency siya. Kasi pale dok pati thin. At saka, nga, pale ang tang pati thin.
Okay, very good.
Posit in the upper burner. Kasi may red sa ng heart.
Hit in the upper burner, ito po, no?
May red siya sa tip sa heart. Tip sa tang.
Okay. At saka do you notice dry ang throat at thirsty?
Yes po.
Severe palpitations. Okay. Onset of stomach and kidney deficiency. Bakit siya onset? Hindi pa malalim masyado yung crack. Hindi pa ganun kahaba. Lack of fluid in the stomach. Yeah.
Yes.
But look at the kidney areas, Doc. Ewan ko, is it purplish already? Or grayish?
Grayish
It's
na?
actually, oo.
Tapos medyo malalim siya?
Internal heat. Bakit internal heat? Kasi po, sobra na yung deficiency niya dito sa kidney. Pero sabi nila dito, onset of stomach and kidney deficiency. Okay?
Onset ba lang ba na?
Baka
Anyway,
mas malalim
pero
kasi siguro kapagka na talaga.
Pag internal heat kasi, ibig sabihin may sira na yung kidney pati yung heart. Okay, let's go to the next. 28-year-old female. Dito na naman itong kakaibang indentation. No? Ma'am na unstoppable, do you want to analyze by reading the... It's there. Please explain. We will listen.
Sobra yung heat niya. It says, yellowish na yung coating. Tapos madaming, yung sa heart area niya may problema. Tignan niyo yung grayish na ba to? Or purple na to siya? But anyway.
Tingnan mo yung mga symptoms.
Symptoms, night sweats.
Of course, ito makikita natin, no? Anong significance nito? Anong ng symptoms? Like, of course, if we are presented with symptoms, we try to correlate it with what we observe on the tongue, no?
May heat siya do kasi nag-night sweats.
Okay, yin deficiency, di ba?
Yes po.
Insomnia. Bakit siya may insomnia?
Because of blood deficiency.
Very good. Shortness of breath.
Kasi reddish ang lang heart pati lang portion.
Inner tension.
Inner tension. Emotional. Reddish ang tip niya do.
Exhaustion. Ibig sabihin,
yung third.
ang essence niya affected na, no?
Yes po.
So deep horizontal cracks, super deep. So yan pala yung deep. Dry tongue coating without root. So without root, so yung kidney area niya, wala ng coating. Western diagnosis, na can you imagine? Wala. O is the patient 28? Kung imagine mo, walang magawa. So ang background to disease niya, difficult pregnancy and birth. So can you explain po bakit difficult ang pregnancy?
Because of sana ha.
Based on your TCM diagnosis.
Lack of fluids.
Okay.
Deficiency, kidney.
It's a kidney deficiency, di ba?
Kasi ano na yung kidney deficiency, kuwan lang yan, ano ba yan, malaki sa uterus. Hindi ko sure saan sa
Di ba the kidneys controls the reproductive system?
Yes, kidneys. Yes, very good. And yung coating niya wala ng root. Ibig sabihin, wala na siyang coating doon sa may posterior third. Ibig sabihin, ang hina na yung kidney niya. Very good. So yung mga ganyang babae, kidney deficiency, they may have difficulty giving birth. Okay? Next, Mama Unstoppable, 35-year-old female.
Pasensya na po, may kausap lang ako sa South Africa. Sorry.
Who would like to try, Ma'am Mimi? Try lang po. Nandito naman yung mga answer. Just correlate the observation with what we see on the tongue. Busy din siguro si Ma'am Mimi. Who would like to try? Okay, Ma'am Betty.
Dry,
Dry tongue.
firm tongue body.
Tapos pale siya. Tapos may mga horizontal and vertical crack.
Okay. Ano po yung connection ng dry cough sa nakikita nyo? Ano yung connection ng dry throat? Difficulty with inspiration or inhalation. Alam niyo, pag nahihirapan po tayong huminga palalim, pag inhale, inspiration is another term for inhalation. That means yung asthma natin or yung difficulty of breathing natin is due to a kidney problem.
Oh. Kasi yung kidney grabs the chi.
Yes, very good. The kidney grasps the chi. Very good. In the lung. Difficulty in breathing during the night. So, bakit during the night, hindi during the day? Kasi naubos na yung yin niya. No? Sa dami ng crack. Very good. Ito rin po yung kanyang diagnosis. So, kung napansin nyo, kung meron po tayong diagnosis na allergic rhinitis, allergic asthma, usually ganyan po yung tongue. And usually may family history din. So tatanungin natin kung mayroon bang members sila ng family, baka parents siya may asthma, naman na din na yun. Okay? TCM diagnosis, paki-explain po, Ma'am Betty.
Sandali. Nawala kasi ako. Ano siya? Lack of fluid because of yung dryness. Tapos yung stomach, nagkaroon na nga siya ng kidney deficiency.
Okay. Very good. Slight deficiency ng blood kasi hindi pa naman siya that dry, pero talagang marami na po siyang cracks. No? Yun. Very good. So napansin nyo, pag pale pa po yung tongue, hindi po naman siya red, ang diagnosis nila, slight pa lang. Onset, no? Onset, nagsisimula pa lang. Next po, 42-year-old female. Karili nyo na, Ma'am Betty.
Ano to?
Unang tingin nyo, huwag mo na tingnan yung description.
May
Tingnan
marami
natin
siyang
kung nakapagtugma.
crack.
Okay, of course, crack.
Tapos sa
Then,
center, may crack din siya without coating na. Tapos
okay.
meron tin coating banda doon sa may ah, sa middle burner.
Dito.
Opo. Pero parang mas
Yellow.
marami sa kanan, sa right side, kaysa sa left.
Okay. Ito. And then, one-sided coating. Itong dito, hindi masyado, di ba? Ito
Opo.
makapal. Now, symptoms po niya, bakit kaya siya may burning sensation sa dila? Ano po ba yung dila? Like, pag dila ang pinag-uusapan, ano po yung may organ na may problem?
Burning. Sa ano? Sa heart.
Very good. Night sweats. Bakit po may night sweats?
Night sweat.
Ano yung nasa
Sa-
isip natin? Ano sa palagay niyo bakit may night sweats yung pasyente? Dahil maraming
Crack?
okay, crack. Kasi po may ano na siya. Saka napansin niyo, reddish na po yung tongue.
Opo.
Reddish na siya. And may mga cracks. So ibig
Yes.
sabihin, meron na siyang yin deficiency with heat. Siyempre, pag na-night sweat kapag may heat na, di ba?
Opo.
Palpitations. Bakit po may palpitations?
Sa heart, dito sa may
Okay.
red.
And also
Insomnia.
insomnia, no? Frequent smelly loose stools. So, pag may amoy po yung ating tumi, pag sinabi nyo kasing loose, damp po yan. Pag smelly, damp and damp heat na. Tinan natin na, ewan ko lang. Kasi ito na po, yellow po kasi ito no? Napansin nyo? Okay, pain under the right hypochondrium. Right rib
Kaya.
cage. Ito, so may kinalaman po
Kaya
ito.
siya may coating.
Chi stagnation, liver. Ano pa po? Inner restlessness.
Restlessness.
Parating balisa. So Western diagnosis, tinan nyo po, na
Wala.
So, ating pupunta. Kasi, ibig sabihin yan, marami ng test ginawa, expensive pa naman, negative. Pero, tayo, tumingin tayo sa tongue, no?
Yes.
So, Western diagnosis, walang, sabi pa naman nila, no cause, no cure.
Napagastos na ako sa una, dako ako gastos sa blood chem.
Hindi nila alam yung cause eh. None.
Kana negative, pero I'm in pain.
Correct.
Bigyan ka lang ng pain reliever.
Ay, tulad ko, ma'am, sinabihan ako somatoform disorder lang daw. Sabi ko, ano yun? Yung iniisip mo lang may sakit ka, tapos wala. Sabi ko, hala.
Alam mo, ma'am, kung ano niresita na sa akin? Aspirin.
Diba? Akin, mefenamic acid. Sige daw.
Parang sabi, psychological effect.
Kaya nga, sige lang, tuloy-tuloy lang tayo kahit pa konti. Pero dadamit, 10 na nga tayo eh.
Dito apply natin si Ma'am Cyril. Good evening.
Oh, Ma'am Cyril.
Welcome.
Hello. Grabe.
Good evening, Ma'am
Hello,
Cyril.
Ma'am Cyril.
Nakapasok din.
Ma'am Sai. Good evening, Ma'am Sai. Alamang kaklina, Ma'am Sai, sa clinic.
You unmute your mic, ma'am, para marinig ka namin.
Hi. Good evening po. Nakikinig lang ako.
Salamat kayo, Ma'am
Ay,
Sai.
wow, bongga. Kumusta ang Zumba?
Sana
Na Zumba, busy sila sa kampanya.
Buti na lang hindi ako nagkakaroon ng halaman. Wala ka doon.
Hello, Ma'am Sumile. Kumusta?
Good evening. Hinanap kita kanina sa clinic, wala daw ka.
Oo, may pinalo up ako yung kay Ate Ro. Yung namatay din, COVID daw. Ginawa nilang COVID. Pero actually, siya, diabetic siya, tapos may problem na sa kidney. So ilang lang siya oras dun sa General Hospital. Tapos tinest nila na swab, positive daw.
Okay, hala.
Kaya yun.
Grabe man.
Nalo ako yung death certificate kasi positive, i-swab daw yung wife. So, mag-isa lang man yung auntie ni Atero daw. Walang anak yun. Kaya ako na lang nag-follow up.
Very good.
Ano niyo po yung namatay, ma'am?
Wala po. Doon kasama namin po. Yung sa clinic.
Ganun na talaga ngayon. Sa totoo lang, kahapon namatayan kami. Anak ng kapatid ko. Namatay siya at 12 ng tanghali. Ano din yan, ma'am? Diabetic na may problema na sa kidneys. May problem. Actually, type 1 kami eh. Nag-i-insulin na yon. Nung pinasok dahil nagsuka yun, tapos negative naman. Kahapon namatay at 12. Alam ko, hindi niya... 2 o'clock? Namatay ng alas 2. Na-shock na lang kami. Ready na daw ilibing. Sabi ko, hindi na kailangan ng papers? So, nailibing na siya kaagad. Alas 6, nakita namin. Nasa loob na siya ng mixo.
Hala.
Kaya nga, nakabalot na kaagad. Parang di na wala nang dasal-dasal. Tapos hanggang doon sa ma'am, hinatid siya sa Golden Heaven. Hindi din maka-attend yung yung family. Ako din maka-attend. Kasi mga contact tracing ba? Di ako hinatid ko na din yung patay. Doon ako mag-isa.
Kasi ikaw na hala ka dyan.
Ano ni Rose yung Cyril? Ano ni Rose yung Tio?
Yes, dog. Parang ganon na. Kasi auntie niya yung yung wife.
Hala.
Pero actually, diabetic yung matagal na yun kasi pumupunta doon si Ate Nina sa clinic. Diabetic yun. Hindi siya positive.
So, inaway mo kung bakit positive.
Naway ko do kasi ayaw ibigay yung medical certificate. Sabi ko doon sa sa hospital, ma'am, ilibing na kasi yan na nagawa yan na yung doon sa Golden Heaven. Sabi niya, ma'am, hindi ka kaano-ano ng yung namatay. So hindi namin pwede i-release. Sabi ko, siguro ma'am, di yan totoong COVID. Di dyan na lang muna yan sa inyo yung patay. Basta wag niyo muna daling kung saan-saan. Tapos lumabas yung isang doon. Tauhan nila. Sinabi, ma'am, ito yung papel. Sige, bigay mo na lang yan. Pwede mo na kunin yung patay. Loko talaga, pera-pera lang. Kasi ang sabi daw nila, 250 yung per patient na may COVID.
Saan hospital,
So,
ma'am?
lalo na pag severe.
Ma'am Sai, saan hospital?
General.
Tapos
sasabihin nila, i-isolate ka ng 28 days. Then, pag nandun ka na sa isolation area, may paper sila ipa-fill up. Nandun ka na 7 days lang. Pero yung ipi-fill up, i-sign mo na form, 28 days ka naka-isolate. Tapos babayaran ka.
As in. Kasi ma'am, kasama na dun sa pag-stay mo doon, kung saan nila declare na pinasok ka nila, no?
Opo, kaya nga.
Tapos yung pupunta sa'yo mag-check. Grabe. Yun
Kawawa.
sa pamangkin ko, na-shock ako nung sabi nila patay na. Nawagan ko na yung mama sa loob ng ospital. Sabi ko, asan na siya ngayon? Sabi niya, nasa loob na ng black bag. Sabi ko, Tapos sabi, sa isip-isip ko lang nung nakausap ko kahapon sa hapon na yung mama, sabi niya, kasi sabi namin, nung parang tumaas yung sugar, tapos ang mata daw tumirik. Sabi ko lang, damihan yung pantumin. Yung mama, hindi man alam tong pantumin natin, hindi ganun kaano ba. Sabi ng doktor, patay na daw yun, pero pag nilagyan ko kasi ng pantumin, umagalaw daw yung mga fingers.
Talaga.
Kaya sabi ko, baka mamaya, nakuma lang yun, tapos nilagay sa bag, syempre, hindi na kayo. Anyway.
Ibalot na lang nila, no?
Ay, grabe. Binalot to sa cellophane, tapos nilagay na kaagad-agad sa tabaong, ready na for living. Sabi ko lang, Dati, kailangan mo pang kumuha ng ganito, mga papers na ganito. Well, kaya nga, mahirap. At least, importante, alam natin, status ng
Kaya nga, hindi nila tinatapos yung COVID dito sa Pilipinas kasi they enjoy it. Dami kasi pera pag sa COVID.
Okay, sige. Thank you very much, Ma'am Cyril. For the bad news. Ganun talaga, COVID na lang, kay mas malaki ang reimbursement. Okay, let's continue po. Ma'am Noemi, Ma'am Unstoppable, can you tell us bakit ito ang diagnosis? Okay, tingnan niyo yung background of this disease, no? Overwork yung patient. Okay, ano ba yung impact ng overwork? Di ba humihina yung ating kidneys?
Yeah. Caffeine abuse.
Caffeine abuse will actually affect your stomach, right?
Yes. Pregnancy at a late stage. Yun, mag-kidney deficiency.
Kidney deficiency. And itong slight retention of damp heat in the liver and gallbladder, can you see this?
Yeah.
Dahil yung kanyang symptom, frequent smelly loose stools. So, pag yung dumi natin, aside from being loose kasi is dampness. Smelly is heat, mainit. So, yun. Diba? Diba, Ma'am Teresita, ano pa ba yun? Pag medyo damp heat, dumidikit yung dumi sa
Ayos po.
stools. Okay. Siyempre, loose, smelly. So, yun. Kaya alam na natin yan. So kung walang Western diagnosis, gagawing COVID. Okay, so reddish ang tongue. Okay, ang dami kasing diagnosis, dinilit ko yung iba. Kasi imagine, slight kidney. Ano ba talaga? So I don't think it is only slight, no? Kasi red na po yung tongue. And the cracks are distributed over the entire tongue body, right? And the center of the tongue is red and without coating. So, doon pa lang, alam na natin na stomach kidney. Yes. Do you agree, Ma'am? So, ito na po yung diagnosis natin. Bakit? Slight retention of damp heat or damp heat in the liver. Slight, kasi siguro dahil dito lang siya mas matindi. Dapat daw kasi, siguro lahat yan. Anyway. So parting words.
Parking.
Okay. We still have time. Ano pa ba? Meron pa ditong ibang about cracks, no? Tapusin na lang natin to hanggang sa maubos ang time. And I hope ipunta na tayo sa cracked tongues part 2. I'll make this short lang. Okay, 41-year-old female. This time, pale po yung kanyang pagka-red. Pale din yung sides. Okay? Curled up edges. So isip mo kaagad liver. Horizontal cracks in the center. Depression here at the root. Headache symptoms kasi may liver. Liver, probably this is liver blood deficiency. Pain in the shoulder girdle. Shoulder. So gallbladder yan. Or ano ba yung mga ano dyan? Inner tension, exhaustion, poor memory, depression, and toothache. So Western diagnosis niya, onset of periodontitis. Ito yung inflammation of the teeth and gums. Okay. So pregnancy at the late age din. Wow, pag pregnancy at the late age, talagang affected po yung what?
Kidneys.
Kidney. Very good. And also liver blood deficiency. Bakit ko sinabing liver blood deficiency? Kasi maputla po siya. Orange na orange, no? Nag-stand out po si liver. So, breastfeeding for a long time. Pag ang mother nagbe-breastfeed, let's say, 5 years old na yung bata, breastfeed pa rin, nauubos na pati yung nutrients niya. So, yeah.
Nauubos ang essence.
Oo, kasi blood is related to fluid or breast milk. So, nauubos na yung essence, nauubos na yung yin. Lack of sleep, yun. Imagine mo breastfeeding for a long time, iba na siguro nagbe-breastfeed.
5 years.
Tatay na.
Yeah. So liver blood deficiency, liver qi stagnation, or liver qi constraint, no? Lack of fluids, stomach yin deficiency, yes. Onset of kidney yin deficiency, onset of essence deficiency. Okay? Kasi meron na po siyang problems sa teeth and gums. Okay? So parting words, Miss Naomi?
Right, thank you so much. Unang-una, Doc, sa'yo for sharing your precious wisdom. Sa lahat ng mga
nagre-review lang tayong lahat.
Hindi, ikaw yung talagang puspusang dito.
Para ito sa economy, charot. Hindi, totoo lang, no? Ganito lang, ha? Don't look at it, siguro nagtataka kayo, bakit libre? Bakit para akong sira ulo? Sa totoo lang, pag hindi natin ito ginagawa, sa tingin nyo, bibigyan ng libro, aaralin mo yan.
Totoo.
So, I found this a very good platform.
This would be a legacy, though.
I'm running for president, charot.
Wow.
Joke lang. O, di ba? Vote niyo na si Manny Pacquiao. Wow, magna-run talaga si Manny. Yeah. Ay, sorry, baka mag-anak. Baka si Cyril, Manny.
Ang kubianan ako.
Transport.
Hala. Okay.
Grabe ka, Doc, ha?
Hindi,
No.
ganito.
God
Maganda
will bless you more.
Yeah. Kung napansin nyo, nag-attend kayo, Ma'am Beth, nung si Dr. Talavera nung Saturday. Napansin nyo, as in, importante talaga ang tab, no?
Opo. Naalala ko nga po kayo.
Parang natik-up na natin lahat. No?
Simple lang ang points niya, no?
Oo, simple lang. Pero ang galing ng kanyang presentation. Halata
Yes.
talaga nagawa niya yun sa mga patients niya. Okay. So, maraming salamat po. Alam ko, inaantok na yung iba dyan. Ma'am Real, sana wala nang ibang matigo. Ganun talaga. Kaya, attend kayo ng 4:30 ko kasi I'm focusing on depression. Kasi maraming nadidepress.
Ang dami nabubuang.
Oo. Kaya itindihin daw talaga bakit nabubuang ang mga tao. Anong impact? Grabe talaga, no? Pag inisip mo daw talaga na magkakasakit ka talaga. Kaya pag nagka-COVID ka, inisip mo na kaagad, naghihingalo ka na eh. Iniisip mo na kaagad, buka na lang.
Of attraction, di ba?
Yes.
Dapat talaga, Dok, nilalabanan. Pag mahina talaga ang loob mo, madadala ka.
Hindi, i-divert mo yung... Kasi pag inisip mo, naku, kailangan na ako...
Nakakainin na naman ako dito.
Okay. Sige po. Maraming salamat sa lahat.
Salamat.
Thank you po, Cyril. Please invite Sir Timothy Miranda.
Yes, Doc.
Okay, bye-bye.
Bye, everyone.
Bye-bye. Good night. Good night, everyone.
Bye-bye. Ingat. Continue the
May
bye-bye.
F7 tayo pala. Sino to?
Ha?
May isa pala tayong guest. Hindi natin na
Siya din naman yung Oppo F7 doon sa nung Saturday. Di ba lang, makikilala din natin si Ma'am or si Sir.
Sige.
Okay.
Thank you so much.
Thank you very much.
Thank you,
Good night.
everyone.
Bye-bye.
Bye.
Bye-bye.
Bye.